Hey everyone, I'll be talking about sleep apnea. Sleep apnea is caused by being a male, overweight, being over 40 years old, having large neck and large tongues and small jawbones. It's also genetic and nasal obstructions. The symptoms for sleep apnea are loud snoring, episode in which you stop breathing during your sleep, and gasping for air during sleep, awakening with mouth dry. Also give you morning headaches and difficulty paying attention while awake. Um, the treatment for sleep apnea is seeing a doctor and over counter medication, dental appliances to reposition of the lower jaw bones. Lifestyle changes are a very effective way of treating sleep apnea as well, such as losing weight, avoid alcohol, and quit smoking. There's no transmission for sleep apnea. The side effect for sleep apnea is if left untreated, sleep apnea can increase the risk of health problems, including high blood pressure, stroke, heart failure, irregular heartbeats, heart attack, diabetes, depression, and headache. The effectiveness for treating sleep apnea is CPAP mask seems to be very effective against sleep apnea, and the dental appliance with reposition of the lower jaw bones. The cost without insurance treating sleep apnea can be quite expensive. The typical PAPS mask can cost from around $1,000 to $4,000. The leading health problems for sleep apnea for obstructive sleep apnea might increase your risk of recurrent heart attack, stroke, abnormal heartbeats, and the trends and need for of diverse population estimate that 22 million people might be infected by sleep apnea in America alone. There are three types of sleep apnea, and I'll be going over all three types. So the first type is obstructive sleep apnea, is more common of the two forms. There's two forms actually of the sleep apnea, and the obstruction forms is the blockage of airway, usually when the soft tissue in the back of the throat collapse during sleep. So we have short breathness during sleep. And there's central sleep apnea. Unlike obstructive sleep apnea, the airway is not blocked, but the brain fell to signal the muscle to breathe, which is the central sleep apnea, which is not as common as the obstructive sleep apnea, and they all could be treated when they could all be treated if being taken care of. Thank you.